Hair loss, also known as alopecia, is a common concern that affects millions of people worldwide. It can be a source of insecurity, stress, and even depression. Hair loss can affect men and women of all ages. It can manifest in various ways. Some people experience gradual thinning, while others face sudden patches of baldness. The good news is that hair loss is often treatable. Understanding the causes, treatments, and myths surrounding hair loss is crucial for effectively managing the condition. This essay will delve into the medical and lifestyle factors contributing to hair loss. We will explore available treatments, debunk common myths, and discuss the psychological impact of hair loss. It is important to remember that you are not alone in this journey. With the right knowledge and support, you can take control of your hair loss and explore the best course of action for your individual needs. One of the most common causes of hair loss is genetics. This type of hair loss is known as androgenetic alopecia. You might know it better as male or female pattern baldness. In men, it often presents as a receding hairline or bald spot on the crown. Women with this condition might notice a widening part or overall thinning on the top of their scalp. Genes we inherit from our parents determine our predisposition to this type of hair loss. These genes affect how sensitive our hair follicles are to dihydrotestosterone, or DHT. DHT is a hormone that causes hair follicles to shrink and eventually stop producing hair. While genes play a significant role, they are not the only factor. Hormonal changes, medical conditions, and lifestyle choices can also contribute to hair loss. Understanding these factors is crucial for determining the root cause of your hair loss and finding the most effective treatment plan. Hormones play a vital role in hair growth. When hormone levels fluctuate, it can impact our hair. This is especially true for women who often experience hair loss due to hormonal changes during pregnancy, childbirth, and menopause. During pregnancy, elevated estrogen levels can prolong the hair growth cycle, resulting in thicker, fuller hair. However, after childbirth, estrogen levels drop dramatically. This can trigger a sudden shedding of hair known as telogen effluvium. This type of hair loss is temporary and usually resolves within a few months. Menopause is another time when hormone levels shift significantly. The decline in estrogen production can lead to hair thinning and hair loss. This is because estrogen helps to keep hairs in their growth phase for a longer period. As estrogen levels decrease, hair follicles may shrink, resulting in thinner, finer hair. Sometimes our immune system, which normally protects us from infections, can mistakenly attack healthy cells in our body. When this happens, it can lead to autoimmune disorders. Some of these disorders can cause hair loss. Alopecia areata is one such condition where the immune system attacks hair follicles. This results in patchy hair loss, often appearing as round or oval bald spots on the scalp. These patches can vary in size and may even connect to form larger areas of hair loss. Another autoimmune disorder linked to hair loss is lupus. Lupus is a chronic inflammatory disease that can affect various organs, including the skin and hair follicles. Hair loss in lupus can be patchy or diffuse. It may be accompanied by other symptoms such as fatigue, joint pain, and skin rashes. Section 5. Lifestyle culprits, stress, diet, and hair habits under the microscope. While genetics and medical conditions play a significant role, certain lifestyle factors can also contribute to hair loss. Stress, for instance, is a well-known trigger for hair loss. When we experience stress, our bodies release hormones like cortisol. High levels of cortisol can disrupt the hair growth cycle, leading to hair shedding. Nutritional deficiencies can also impact hair health. Our hair needs a variety of vitamins and minerals to grow strong and healthy. Iron deficiency, for example, is a common cause of hair loss. Iron is essential for the production of hemoglobin, which carries oxygen to our cells, including hair follicles. Without enough iron, hair follicles may not receive the nutrients they need to grow properly. Certain hair care practices can also contribute to hair breakage and loss. Overstyling with heat tools, tight hairstyles that pull on the hair, and harsh chemical treatments can damage hair shafts, leading to breakage and thinning. It's important to treat your hair gently and choose hair care products that are suitable for your hair type. Section 6. The truth about treatments. Separating fact from fiction. The good news is that there are effective treatments available for hair loss. The best approach often involves a combination of medical treatments, lifestyle changes, and alternative therapies. It's essential to consult with a qualified healthcare professional to determine the underlying cause of your hair loss and create a personalized treatment plan. One of the most common medications for hair loss is minoxidil, also known as Rogaine. Minoxidil is a topical solution that is applied to the scalp twice daily. While its exact mechanism of action is not fully understood, minoxidil is believed to work by widening blood vessels in the scalp and prolonging the growth phase of hair follicles. Another medication used to treat hair loss is finasteride, also known as Propecia. Finasteride is a pill taken orally once a day. It works by blocking the conversion of testosterone to DHT, the hormone that shrinks hair follicles. Finasteride is only available with a prescription and is not suitable for women. Section 7. Medications and therapies, exploring your options. In addition to medications like minoxidil and finasteride, other medical treatments can help address hair loss. Platelet-rich plasma, or PRP therapy, is a relatively new treatment that involves injecting concentrated platelets from the patient's blood into the scalp. Platelets are rich in growth factors, which are believed to stimulate hair growth. Low-level laser therapy, or LLLT, is another treatment option that uses laser light to stimulate hair follicles. LLLT devices are available over the counter and are commonly used as a home treatment for hair loss. While LLT is generally safe and well tolerated, its effectiveness in promoting hair growth is still under investigation. For some individuals, hair loss can be a side effect of certain medications. If this is the case, your doctor may be able to adjust your medication or switch you to a different drug that does not cause hair loss as a side effect. Section 8. Surgical solutions, when other avenues haven't worked. When medications and therapies fail to produce satisfactory results, surgical options may be considered. Hair transplantation is a procedure that involves moving hair follicles from one part of the body to the scalp. This procedure is typically performed on individuals with male or female pattern baldness. During a hair transplant, tiny grafts of skin containing 1 to 4 hair follicles are harvested from the donor area, usually the back or sides of the head, and transplanted to the balding areas. Hair transplantation can provide natural-looking results that can last a lifetime. However, it is essential to have realistic expectations and understand that it may take several months for the transplanted hair to grow. Hair transplantation is a surgical procedure with potential risks and complications, like any surgery. It is crucial to consult with a qualified and experienced hair restoration surgeon to determine if you are a good candidate for this procedure. Section 9. Nature's Arsenal. Can natural remedies combat hair loss? While there is limited scientific evidence to support their effectiveness, some natural remedies are often touted as potential treatments for hair loss. Saw palmetto is a plant extract that is believed to block DHT production. It is commonly found in supplements marketed for prostate health and hair loss. Biotin is a B vitamin that is essential for hair, skin, and nail health. Biotin deficiency can lead to hair loss. However, there is no evidence that taking biotin supplements can prevent or reverse hair loss in individuals with adequate biotin levels. Rosemary oil is another natural remedy that is sometimes used to promote hair growth. It is believed to work by stimulating blood circulation to the scalp. While some small studies have shown promising results, more research is needed to confirm its effectiveness. Section 10. Debunking hair loss. Myths. Setting the record straight. Numerous myths and misconceptions surround hair loss. One common myth is that wearing hats causes baldness. This is entirely false. Hats do not cause hair loss. Another myth is that frequent shampooing leads to hair loss. Washing your hair regularly does not cause hair loss. In fact, it is essential for maintaining a healthy scalp and preventing buildup that can clog hair follicles. Some believe that only men experience hair loss. This is untrue. While hair loss is more common in men, women can also experience hair loss due to various factors, including genetics, hormonal changes, and medical conditions. It is important to rely on credible sources of information and consult with a qualified healthcare professional to separate fact from fiction regarding hair loss. Section 11. Coping with hair loss. You are not alone. Hair loss can significantly impact a person's self-esteem and quality of life. It is essential to remember that you are not alone. Hair loss is a common condition that affects millions of people worldwide. If you are struggling with hair loss, do not hesitate to seek support. Talking to a therapist or counselor can provide emotional support and coping strategies. Joining a support group can connect you with others who understand what you are going through. Remember that you have options. By understanding the causes, treatments, and myths surrounding hair loss, you can take control of your hair health and explore the best course of action for your individual needs. With the right knowledge and support, you can navigate the challenges of hair loss and live a confident and fulfilling life.